In 36 states are battling coronavirus cases. As the coronavirus crisis continues, nursing home residents are among those most likely to die from the coronavirus.
And as the death toll continues to climb, the nursing home industry is asking states for immunity from lawsuits from owners and employers of the nation's 15,000 facilities. And joining us now to discuss this legal issue, our chief legal expert, Dr. Laura McNeil. And Doctor, thank you again for joining us. And what are some of the major concerns with granting nursing homes immunity from COVID-19 liability?
Well, I think one of the major concerns is that you don't want to incentivize bad conduct or neglect. And so the concern is by granting nursing homes these type of immunity that you might allow them the space to be neglectful and to be harmful. And the reason this draws a lot of concern is, as we know, nursing homes house some of the most vulnerable members of our population, many of which are unable to speak, so they can't serve as an advocate for themselves. And then when you couple that with the fact that family members are now banned from visiting nursing homes, you've lost that extra layer of accountability.
Well, and that was going to be my next question. You don't have that outside supervision. You don't have that second set of eyes on your loved ones to go in there and to see that they're being well taken care of. So don't those nursing homes have the responsibility to handle that?
They do. And so legally, prior to this COVID-19 crisis, it was well understood that if a nursing home was negligent, meaning nursing homes, yes, have a duty of care they have to provide to their patients or residents. Second, if they breach that duty and that breach causes an injury to that nursing home patient, that they can be held legally liable. And what's happening now is states are saying, wait a minute, we need to consider the fact that a lot of nursing homes don't have the proper personal protective equipment. And so they're unable, in many instances, to prevent the spread of the coronavirus, which of course, unfortunately, results in a lot of death in that very vulnerable population. So it's difficult in trying to determine how do we strike a balance between protecting those nursing home residents, but also recognizing the shortage of supplies.
The shortage of supplies and the residents, yes. And there's another issue, and that's the employees of nursing homes. Many of them, I don't want to say they're unskilled employees, but they're not high-end emergency room physicians, for example, or nurses or emergency room nurses. So what kind of liability do the homes have as far as protecting those employees who come in and take care of our loved ones each and every day?
Yeah, so they're required under OSHA, the Occupational Safety and Health Act, to provide a safe work environment for those nursing home employees. And the level of protective equipment they're required to provide those employees is based on the risk of exposure. So in that situation, it's very similar to, as you mentioned, an emergency room where there is a high probability that there will be exposure to the COVID-19 virus. Therefore, they are required to provide gowns, gloves, protective masks as well. And so if they don't do that, then they would be held responsible. But because of acts such as the one passed by the governor of New York, they are exempt, meaning the act recognizes and acknowledges we can't hold nursing homes responsible for equipment they simply don't have access to.
And one final question for you. As far as regulation is concerned, there are some new laws and regulations coming on the books, and I don't know if they're universal all across the country, where there are certain requirements made that if someone does pass away from a respiratory problem in a nursing home, or 2 or 3, that some sort of supervision or some sort of protocol has to kick into place. Is that not right?
It is. And so essentially you have, for instance, Governor Cuomo of New York has required nursing homes to notify family members what the cause of death was, especially if it's COVID-19. And if there are a certain number of COVID-19 deaths or deaths that look suspicious in terms of is there neglect, they are launching investigations of those nursing homes, again, as an effort to try to maintain accountability for any wrongful conduct.
All right, wonderful. Thank you so much for joining us, Dr. McNeil.
Thank you.